Asian Americans are the fastest growing racial ethnic group in the United States. In Michigan, since 2000, it has 71% of growth for Asian American. Here in Hamtramck, this is the city has the highest Asian population, where 24% of them identify themselves as Asian. Despite the myths that Asian Americans are model minorities, I've seen the health disparity in every aspect and level. REACH, R-E-A-C-H, stands for Racial Ethnic Approaches Toward Community Health, and is currently housed at Eastern Michigan University Center for Health Disparity, Innovation and Studies. The primary goal of REACH is to reduce chronic disease burdens among Asian Americans and implement policy, system, environments change strategies to improve nutrition, physical activity, and community clinical linkage.
The key issues that surround food and nutrition for Asian Americans here in Michigan, they're assimilating to our culture. However, that assimilation sometimes involves access to less healthier foods, and they need to be able to find their culturally appropriate foods for them. Our partnership with Friendship House is key to our REACH team as far as impacting nutrition policies. We're offering healthy food samples, and it's our hope that these samples will increase the offerings and the choices here at the pantry, that the residents will take the healthy choices, try those recipes at home, and be comfortable with foods they may not have tried. And there's just all kinds of beautiful fruits, vegetables, dairy products, a real variety of healthy foods. And so what they offer here at Friendship House, which is almost 60,000 pounds of food a month, is all the healthy choices that contribute to good nutrition.
In the EMU CDC REACH team, I'm leading the physical activity domain. And my research uses geographic information science to solve public health problems, such as the food desert, active living, or finding the disease diffusion patterns. Our REACH project, I use GIS to visualize a couple factors that is associated with community health. For instance, we create a variety of maps ranging from transportation needs to food environment, active living, safety, and walkability to show what are the barriers or opportunity that people living in this community they are facing. And our goal is to use this Hamtramck Health Atlas as a story map to communicate with the community as well as the stakeholder and policymakers, so they will know where there is a need and they need to put more effort on in the community.
In the community clinical linkage of REACH initiative, our bilingual community health navigators are working diligently to help low, limited English proficiency clients to understand the importance of preventive health care services.
Our community here, most of them are immigrant, and also literacy level is very low, for which they don't understand their rights and responsibilities, and they become the victim of health disparity. So my part as a navigator is to enroll the community people for ACA marketplace, which is popularly known as Obamacare. And they are getting advices what to do and how to talk with the primary care provider and what are the rights they have got to ask the primary care provider. So they are improving.
So Bangladesh American Public Affairs Committee was formed in 2004, and BAPEC has been working with other communities and other political organizations to ensure that the concern and the needs of the Bangladeshi peoples are heard, and they have enough access or enough resources about that. Most of the people in this community, they have their medical insurance, they have their primary health provider, but they really don't use them unless it's emergency. So my main goal is to send them to their PCP at least once a month and to manage their chronic diseases like how to control their blood pressure, how to control their blood sugar. And I'm also working to get the local resources that we have available for them.
We also have a statewide active coalition who has the diverse membership and great visions to focus on a wide range of social determinants of health.
ACTIVE, which is Asian Communities Toward Innovative Visionary Environment, acts as sort of the advisory group to the whole program. That's the EMU CDC REACH program. The organizations are centered in various Asian American communities, and so since they're so center focused on their particular communities, they know their communities the best. They can tailor healthy living programs for those particular communities, whether it's in Hamtramck, in Troy, Madison Heights, Grand Rapids.
Moving forward, we are well positioned to make major impact and address a wide range of health issues experienced in Asian American communities, from chronic disease, cancer screening, to mostly recent emerged public health issue, lead poisoning in Detroit. We have a great track record working with our community partners and legislators and public health department. Together, we are making Asian American healthy in Michigan.